Thank you, Mr. Pollard, and thank you very much to the Intercare organizing team for this kind invitation. It's a pleasure and an honor to be here involved in this multi-stakeholder dialogue, so thank you very much. My name is Ilaria Giannico. I'm the Secretary General of the European Union of Private Hospitals, and I will try to introduce you to who we are and what we do, and then I will try to present you our position on the cross-border directive enabling patients to seek care abroad. So, who we are and what we do. The European Union of Private Hospitals is a no-profit federation established in 1991 and based in Brussels, representing and defending the private hospitals in Europe. We represent around 5,000 hospitals accredited by contract with social insurances in 18 European countries through the national private hospital associations in each country. Our mission is to promote the Europe of health and to promote the private initiative in the healthcare sector, an alternative in healthcare which has become absolutely essential because private hospitals offer a service which is complementary to the public one, helping to maintain a healthy competition and a competition which can only be beneficial to stimulate research and innovation, so it can only be beneficial to the patient. We are driven by three main principles, which are free access to healthcare for all European citizens, quality of care, equity and economic sustainability of our national healthcare systems. Private hospitals in Europe wait for the 20% of the global market and are defined by EU institutions as providers of services of general interest. So, because we serve the entire population, so we have a voice, and we wanted to make it heard at all levels, at all European and national levels. Sorry. So, what is the UEHP position on the European directive on cross-border healthcare? I'm not going to go into the directive contents because I know that just after me there will be a specific speech on this. But I will present you more what we are doing and what we have done in the past to help the institutions implement this directive. So, UEHP has been monitoring the implementation of the directive, and we very much welcome the recent shift of the debate from provided healthcare services all over Europe to protecting and enforcing patient rights to equal, safe and quality treatments all over Europe. The private hospitals in Europe promote patients' freedom of choice of the treatment, of the physician, of the place where to be treated, and we believe that the freedom of choice can stimulate a fair competition in healthcare among the different countries in Europe, contributing to the improvement of quality of care and sustainability of national healthcare systems. In particular, we recognize the huge potential of the cross-border directive with a particular focus on, for example, reducing waiting lists, because patient mobility is a chance to offer competitive services on time to an informed patient, reducing waiting lists in all member states. Also, another potential is overcoming the rigid separation of the national healthcare system, because our national healthcare system should be resilient. That means they should be ready to adapt themselves to the changing environments, tackling significant challenges with very limited resources, unfortunately. And this could only be achieved by strengthening cooperation between national healthcare systems, which will enable them to help from each other and work better and functioning better. And this brings us to the improvement of quality of standard of care, because the cooperation and fair competition among member states will stimulate the improvement of quality, not only for patients who are seeking healthcare abroad, but for all the patients in all member states. However, we identified some problems in the implementation of the directive. So first of all, the poor citizens' awareness of their rights. So less than 2 persons out of 10 are informed about their rights on the opportunity to seek healthcare abroad, even if a recent study of the Eurobarometer showed that 49% of patients would be willing to travel abroad to seek healthcare. So, we identified a clear lack of a clear, structured and comprehensive information for patients. We also identified some confusion between the regulation on the coordination of social security systems and the directive on cross-border healthcare. We also identified a very limited involvement of the private sector, which relates to a lack of cooperation and communication with ministries and national contact points. Then we also identified another important problem, which is the administrative burden and time to handle the request. On average, each member state takes around 20 days to just receive and handle the request. Then, of course, the language barriers among the different member states, the low reimbursement tariffs, and the compulsory prior authorization for special treatments and the hospitalization, which has been adopted by 21 member states out of 28. So, what do we call for and what we are doing together with the European Commission? We basically call for an improvement of a structured and concrete communication with all actors involved at all levels. We call for more integration in healthcare, and we ask the EU to enhance cooperation between healthcare providers, patients' organizations, and social insurances. We call for the development of guidelines on a common European accounting systems in order to clarify, for example, what are the eligible costs, what are the reimbursement tariffs, delays, procedures, what is the time for payment, etc. But we also want to be fully involved in the implementation of the directive at both European level and national level. So we asked ourselves, okay, what can we as a European federation can do to help the institutions in this implementation, which is not easy at all. We recognize it. So, first of all, we can get the most information we can and spread it to our members. It may seem obvious, but as I mentioned before, the first problem is communication, is the awareness of the citizens, making them conscious of what are the means that the European Union offers them to really seek healthcare in other member states. Then we can, of course, enhance cooperation with the European Reference Network as prescribed by the Article 12 of the directive. Then at national level, each national association of private hospitals can start a dialogue with all actors involved in its country and can also try to fix a meeting with the ministry and with the NCP to foster contacts and really try to understand, okay, how does it work in our country? Then, of course, we can keep a record of reported issues by hospitals more active in receiving patients abroad, and we can collect all this data at European level and send them to the Commission, help them becoming aware of the problems encountered by healthcare providers dealing with EU patients. And then we can, as we are already doing actually, liaise with other associations of healthcare providers and write common position to help and advise the EU institutions. So I'm very happy I didn't run out of time, and I will leave you with this quote, which I find relevant to today's debate, and I thank you very, very much for your kind attention. Thank you.